So, welcome everybody to today's session, today's interview, CESI Talks. CESI Talks is a series of interviews we are having with key stakeholders, key decision makers within the European institutions, but also from our member organizations. And it takes place within the frame of a project co-financed by the European Parliament in order to bring closer, I would say, the European level or the international level to our members and the affiliates. And today, I'm particularly pleased to be able to welcome Dr. Rade Panic. Mr. Panic is president of the Serbian Trade Union of Doctors and Pharmacists called SLFS. Dr. Panic, welcome.
Thank you. Hello to everyone. I'm pleased to be with you.
Dr. Panic, you have been, let's say, also fighting both as a trade unionist, but as a doctor in a first line in Serbia. What was the impact of COVID-19 on public services in general, but also the public health sector in Serbia?
For years, the healthcare system has been understaffed, losing both young and experienced doctors to brain drain, neglected infrastructure, bad equipment in institutions, low salaries, bad work conditions, employment based on party membership. Thus, there should be no wonder that Serbia met the challenge of the pandemic unprepared. The authority and politician decision-making system which navigating the pandemic has made a better response of the healthcare system impossible. We especially point out the impact of COVID-19 on healthcare workers who had to put in superhuman efforts and are still working on taking in and treating COVID and non-COVID patients. We have already broken through all boundaries of sustainability, particularly because healthcare employees are only viewed through their professional lens, not as human beings. We also point out the spirit towards laws and procedures, as well as irresponsible authorities who, in a day with more than 7,000 new infections, decided that no epidemiological measures be imposed. Additionally, we point out the doubling of the institutions and authorities. We in phases that Serbia is second in the world in terms of new infections relative to population in one day, making it first in Europe. We have vaccines, but the immunization campaign has been a failure. Above all, due to the distortion of information in the media, but also because of a large number of anti-vaxxers with access to national frequency media. There has been an extremely high level of infections among healthcare workers. According to SLFS data, as many as 135 doctors have died through epidemic. As you may know, there were supply problems with personal protective equipment at the beginning of the pandemic, with healthcare institutions not having enough PPE. And all this is very bad and Serbia has bad results in epidemia or pandemic.
You're a doctor yourself. You're a trade unionist. You spoke about the high infection rates among healthcare workers, about the many deaths, about the problem of brain drain, of lacking equipment, the issue of salaries and working conditions, and the superhuman efforts also of the healthcare staff. What was the role of trade unions in general and of the SLFP, so your trade union, in these difficult times?
First of all, the Syndicate works on informing the public about the factual state of affairs from the scene. The only voice that is heard is our voice. SLFS has from the beginning been pointing out oversights to the decision makers and recommending solutions to most of the code mistakes by recommending measures and making requests for improvement. The ministry, above all, has ignored most of this. We have requested the employment of all unemployment healthcare workers from the National Registry of Unemployment. A certain number was employed, but this has mostly been precarious as the contracts were fixed term in most cases and sometimes voluntary. I said many times voluntary.
So you had a quite important impact in a positive way, also to show, to draw the attention also to these difficult working conditions of your members. We have at the moment we're in the process here in the European Union of to revise or to think about the possible revision of the European Union. And my question to you, when you think of public services in general, why should states like Serbia or EU member states or the EU as such, how could I say, facilitate more investment in the public service?
These crises are exactly why. A strong public service and healthcare are the prerequisites of a strong and healthy society. There has been no work on prevention. The pharmaceutical industry is concentrated on curative measures, which is an indicator that neither the world nor us were ready for this all. Preventive is cheaper, but it is not working. On preventive, and it's a mistake.
Dr. Panic, thank you very much for the interview. You take care of yourself. Greetings to you, to your fellow doctors and nurses, and I hope to see you soon. Take care of yourself.
Thank you for support and for all you do for us.
Goodbye, Mr. Dr. Panic. Goodbye, Rade, yeah?
Goodbye, Klaus.